I think risk and regulatory are the foundations of any house, meaning any hospital. One of the key pieces of risk is having a culture around just culture. And for those who aren't aware, that's a culture in which we focus on system improvements as opposed to primarily focusing on people. We focus on the systems by which we put our employees in, nurses, physicians, all staff. And we make sure that we look to see if there's any opportunities for improvements in the system when we see that there's a fallout or a gap in care. And it allows for an environment of growth, right? When you change systems, that's a bigger lift, and you can affect more, most importantly, more patients. But when you just are focusing on people, you actually have a smaller denominator, if that makes sense to you, Chris.
It makes sense.
So I think culture is huge, right? We talk about that every day. So when you ask that question, just to circle back and summarize, why, what's so amazing about risk? What's the most important part of risk? It's about ensuring that you have a culture that is a just culture, so that people feel comfortable to say, listen, this is not working right. They are more transparent because they know that your focus is on systems as opposed to people. So if I have to answer your question, it's mainly around the just culture. Secondly, a close second would be real-time follow-up and making sure that we address gaps in care immediately. And we do that very well. I think now we've come a long way with our occurrence reporting, if you're familiarized with that. I would say back in the days, my mom was a nurse in nursing leadership for New York City Health and Hospital. She retired. She's now 84 years old. Back in her day, they would use, everything was paper when there was an occurrence that happened. Now we have an electronic occurrence, a voice occurrence tracking system, which allows us to look at things in real time. So those are two major issues. Those are two main areas that highlight risk management.